I wanted to take a few minutes and just go over your SOAP note writing with you. I know that SOAP note writing can be intimidating and can be difficult as a student. So I just wanted to take a minute to go over some tips and to review an example with you to hopefully make it a little more comfortable. So as you know, your note should start out with a problem statement. So the problem statement I've chosen is client has difficulty sleeping at night secondary to anxiety experienced as part of her diagnosis of PTSD. Now, although I do mention the diagnosis of PTSD and I do mention the anxiety, I am also concentrating on the functional deficit of difficulty sleeping at night. Then for your subjective statement, it seems like no matter how tired I am, I can't fall asleep or stay asleep at night. I'm constantly falling asleep during the day. I bet these naps make it hard for me to sleep at night. As you can see, the two quotes that are included in the S or in the subjective section are very much related to the information in the problem statement. Now, I could have also said something like client reports and then done just the quotes around no matter how tired I am. So you can adjust the way that you present that information, but bottom line is you want it to be usually no more than 1 to 2 quotes and you want it to be relevant to your problem statement. Then with your objective statement, as you know, you're to start out with where the client is seen, who sees the client, and the date of the services. So that first sentence, client seen for treatment by OTAS on February 1st, 2022 in the psychiatric unit conference room. Then I'm going to state why I'm seeing the client. Client is receiving OT services to address her sleep schedule through modifying her sleep preparation routine. Then I'm going to go into what I observed. Client fidgeted throughout the treatment session. Client was noted to pull her shirt over her mouth, place the collar of her shirt in her mouth, and played with the strings on the hood of the jacket she wore. When the treatment room became silent for more than 1 to 2 minutes, the client would close her eyes and begin to fall asleep. As you can see there, I did not use any judgment statements or any opinion statements. I stated only fact and what I observed. Then in your assessment section, you want to start out that first sentence explaining why you're seeing the patient by restating your problem statement. So client has difficulty falling asleep and staying asleep at night secondary to the symptoms of anxiety experienced due to her PTSD. Then I'm going to go into some of my assessments or my judgments or my professional opinions. So client experiences frequent anxiety and seems to have difficulty relaxing. Client often falls asleep during the day, resulting in the inability to sleep at night. Recommend continued OT services to address sleep preparation routine. Client's prognosis with continued OT treatment is good. Now, as you can see there, I discussed the recommended OT treatment, I discussed the prognosis, and I also made sure that the information that I included was something that I either saw and reported in my O or something that I heard from the client when I listened to her and reported that in the subjective or the S section. Then for my plan, you want to make sure I include my frequency and my duration. So continued OT treatment 5 times a week for 4 weeks. And then why am I doing it? To address sleep preparation routine. OT will address sleep difficulties through modifying the client's sleep preparation routine. So I'm talking about how I'm going to improve the sleep, and I'm going to do that by adjusting or modifying the sleep routine. And then OTAS collaborated with supervising OTR regarding this client's plan of care. As you guys remember, that is a requirement in all of your SOAP notes. And then I signed my name, I included my credentials, and I included the date. Now, if you go to your SOAP note rubric, this is the SOAP note rubric for your real-time SOAP note that's coming up. You want to make sure that your problem statement is identified and related to an occupational function or skill. So that does not mean that you cannot mention the diagnosis. That, however, does mean that you should not concentrate on the diagnosis when making your problem statement. There also needs to be a functional deficit or skill area that needs to be addressed. Then you want to make sure that whatever problem statement you use, that the note addresses that problem statement. So one of the things that I noticed with a lot of your previous SOAP notes is that you guys would make a very broad problem statement, like secondary to client's depression, she has difficulty with IADLs, ADLs, and social participation. Well, that's such broad areas that include so many potential things that it would make it difficult to really write a note that addressed all of that. So you want to make sure that in your problem statement that you include really one thing, but at the most two different things that you could address during your treatment. Then in your subjective section, obviously those are quotes from your clients, but you want to make sure that they're relevant to the problem. If for some reason the client is nonverbal or did not provide any quotes, you might want to state, you can state NA, but you want to state why. So not applicable as client is nonverbal. Okay. Then for your objective section, you want to make sure you include the actual date, your profession, and for you guys, it's OTAS, where the client was seen. So be specific. Don't just say in the hospital. So did you see her in her room? Did you see the patient in the therapy gym? Did you see them in a conference room? Okay. And then you want to also talk about why you saw the client and specific to OT, what was the reason the client was being seen. You want to make sure all your information in your O is pertinent, meaning that it's related to your problem statement, related to the information that you've already provided. And you want to make sure that it's observable and measurable and free of those assessment or judgment statements. So instead of saying something like the client appeared anxious, you would say the client began fidgeting when speaking about taking care of her dog, or the client was frequently moving around in her chair and readjusting her clothing throughout the treatment session. Those are observable statements that are free from assessment. Okay. So then your assessment section, you're going to start it out by restating the problem. And you're going to make sure that that's related to function, like we talked about before, and does not identify the clinical problem or the diagnosis as the problem. Again, that doesn't mean you can't include the diagnosis in your problem statement. You just need to make sure that you're providing what functional ability or skill deficit area is there because of that. Then you want to make sure that in your assessment you do not include quotes, you do not include new information that you didn't already mention in the O or in the S, okay? And then you want to make sure that you include recommendations for either further skilled OT services or no further skills OT services, and then what the client's potential or prognosis is with those services. Again, you want to make sure that the information you provide in your A is pertinent and is an interpretation of the information you received from the client and what they said in the subjective and what they did and you observed in the objective section. Then in your plan, you're going to identify specifically continue OT or discontinue OT, okay? You also need to make sure you include your frequency of OT visits and your duration of OT visits. So saying something like 1 time a day is not a clear representation of the frequency, because 1 time a day would mean 7 days a week. And the reality of it is most OT practitioners do not practice 7 days a week. So services are likely not available that often and insurance is not likely to cover that. So you want to make sure that you state exactly how many. So you might want to say 5 times a week, and then your duration would be 3 weeks or 4 weeks or 6 weeks, whatever you choose. In that plan, you're also going to identify what you will address. So you might address sleep difficulties, and you might do that through modifying the client's sleep preparation routine. And that is something that is specific to the client and is activity based. Then you want to make sure that you include your statement of communication and collaboration of care plan with the supervising OT. Quite a few of you left that statement out, and that doesn't seem like much, but it'll lose you a point, and we don't want to lose points. Then your note needs to be professionally written. So once you've finished it, you need to go back and read it to make sure that you don't have any run-on sentences or sentence fragments, that you don't have any major punctuation errors, and that it flows well. And then you want to make sure you sign your note, including your name, your credentials, and the if you have any questions after viewing the video, please be sure to reach out to your instructor. Thank you.